What are the question marks and the challenges regarding medicinal cannabis use in the United Kingdom? I've identified a series of challenges and question marks that we need to really address regarding medicinal cannabis before it can be approved for regular use for our patients with a variety of long-term health conditions in the United Kingdom. The first big challenge is the accessibility. Right now, there is both limited access and limited accessibility to medicinal cannabis as a whole across the country. This is due to a variety of issues that specifically focus on the supply chain that's available, but more importantly, it comes down to the clinical side that we do not have enough healthcare professionals that are knowledgeable about the drug. And that means that we have not yet got the right kind of confidence and support in giving this in a more wider scale across the NHS. It's not yet as well got the evidence base, so there are no guidelines available for it to be given on the NHS, and that is another reason for limited access and accessibility of it. The second bit is around the cost. Clearly, these are interrelated factors to the accessibility, but the cost factor is just that because it's a new drug, because there are different manufacturers coming through, and there hasn't been a consensus on what kind of product will be right for what patient, it's really a free-for-all right now. So the market is very much a self-pay market, and therefore the cost of the product is not just the cost you would pay for the drug, but also for the consultation, the follow-up, and any other associated treatments when you visit a medicinal cannabis clinic. And that means that right now there is an overall much higher cost when you want to trial the drug for a period of 2 to 3 months, most of which has to be borne by you, the patient, rather than it being funded by insurance or even by the NHS. Another big challenge is the stigma and the perception of it. Now, these are two parts here. One is the general stigma from the society at large about this group of drugs itself that act on the body. There has been a lot of negative perception, both politically, over decades in many countries, and that's something that is very difficult to shift. But the second part of it has also meant that there is hesitancy among the medical profession as well. The awareness of the existence of an endocannabinoid system is not very widely talked about. It's not taught in medical schools, and therefore there is a lot of medical clinician hesitancy in knowing about the drug, talking about the drug, prescribing the drug, and that's a big challenge in itself. The next challenge is the lack of adequate research and therefore guidelines. As I mentioned before, it's only in the last 5 to 6 years that the UK has changed the schedule of this drug from something that cannot be researched upon to now something that can be researched. So research is still in its infancy. It's only now that we are starting to get big, long-term, well-controlled, double-blind randomized studies, and therefore there are no good guidelines that can help clinicians and patients and commissioners provide this drug. So at this time, we are now needing more research so that we can have much better guidelines. At this point of time, the guidelines all understate and underscore the fact that the guidance is not good enough for us to recommend medicinal cannabis for many health conditions. It has only been approved for certain specific conditions like pediatric epilepsy, some forms of it, chemotherapy-induced nausea and vomiting, multiple sclerosis related pain, and possibly a few mental health disorders. Another challenge is the regulatory or the legal complexities. This is something that is related to the previous points I made around the scheduling change. It has meant that legally it's quite difficult to procure or get cannabis and to be able to prescribe it. the systems of prescribing, the regulations for who prescribes it in primary care, how does this drug get supported by the GP if a specialist starts it. All of this has led to a lot of regulatory challenges, and until we have a previous set of research coming through, guidelines following through, we are not going to be able to resolve the regulatory and the legal challenges that are posed by it. Finally, but most importantly, is the healthcare education. As such, raising awareness, raising the level of educational knowledge about medicinal cannabis amongst healthcare professionals is going to be very critical, because at this time, prescribing of medicinal cannabis can only be done by clinicians who have been trained in it and who are confident with it. So unless we raise the level of confidence among a large group of healthcare professionals, including primary care doctors, we are not going to be able to address the challenge of access, accessibility, and cost. I hope this video is useful, and I look forward to seeing you in the next video. Thank you. Thank you for watching this video. I hope you found this of value. Don't forget to hit the like button and subscribe to my channel for more videos on the understanding of pain science and lifestyle medicine.